as I mentioned, we've got various techniques that we can use, and we've found our trigger points, we've located our trigger points, we feel comfortable that we are working on trigger points. We can use our thumbs, we can use our elbow, we can use the good old knobble. I quite like the knobble. It's a nice little tool. I usually walk around, keep it in my pocket. It has a little pointy end, which is very good for the specific areas if you want to do like inhibition compression techniques. It has a latex band around it. Some of these are made of wood, so they don't come with a latex band. It's very good for sort of transverse movements over the tissues. And then we can also actually do some of the deep stroking massage with the flat head. This device is actually very useful for the home regime, which we will be talking about a bit later on. If we've got our trigger points, you've decided they're in the rectus spinae or in the quadratus lumborum, and you're going to address them. There are different techniques we can use. One is a deep stroking massage. You would locate the trigger point, and you could either use the part of the knobble or your thumb, and I tend to use the larger head on the knobble and just rotate it around, getting stronger and stronger. If you want to be a little bit more specific, it's often easier just doing it with your thumbs or your knuckle. To start with, maybe that's what you will want to do, just so you can feel what you're doing. And the idea is that you're kind of rotating massage type movement, or even a transverse massage type movement. Quite useful technique. It's comfortable on your hands, it's comfortable for the patient, and gradually you feel the trigger point melting away. The more common technique is the inhibition compression technique. So termed by Travell and Simmons, because you get kind of blanching of the soft tissues when you remove the pressure. That's the more common technique. It's the one that's more known for trigger point treatment. It lends itself better to the tools, especially if you're using the knobble or any of the other tools. One will basically find the trigger point, apply pressure, and hold it there for 20 to 30 seconds. Sometimes you may do it longer to actually get this sort of referred pain coming on. I often don't feel I have to do that, but some people prefer to do that. And then, having felt the trigger point start to melt away, release, just give a little bit of massage, and then come in again and push in deeply and hold 20 or 30 seconds and release, and then again a little bit of massage and easing, and retake and reassess, because having done these techniques, if we've decided that we had some sort of restriction, we want to see if the restriction has gone. So the restricted movement, whether it be flexion or side flexion, we will do again and reassess that to get an idea if we're on the right spot or we're doing the right thing.
If you found this video useful and want to see more like this, make sure you subscribe below and don't forget to hit the notification bell.